Hi everybody, it's Dr. Sandy Laura Kramers, one of the surgeons at Visionary Eye Doctors. Thank you for joining us again for the EYE podcast, EYE Show podcast and YouTube channel. Today we're going to talk a little bit about particulars of different types of intraocular implants for cataract surgery. As we talked about in the previous podcast, we went through some different types of implants, cataract surgery, the latest and the greatest for 2023. And this morning I was talking to a friend who was going through some of the stats, the statistics of baseball and even the Grand Prix of race car driving. And he was showing me all the different types of data they collect on from when you have a baseball team, all the players, all their runs, their heat map of where they actually tend to hit the ball. They have all kinds of data on their steals, their home runs, of course, and all these, the batting average, all that kind of stuff. But it was very, very detailed information, which I was kind of surprised by because we don't have that same type of information about surgeons and surgery and implants, which is kind of crazy. So if you have this data and you have millions of dollars being spent every year on getting the best data on baseball players and speed car racing, you would think that this would be accessible to patients to pick the best surgeon, pick the best implant. But believe it or not, it's not there, which kind of is mind-boggling. Anyway, whatever you think about that, there's positives and negatives of having a lot of data. But I'm definitely on that side of having a lot of data. I've been doing outcomes research for years. I've done a lot of papers on outcomes research at Harvard when I was there. So now we're going to talk a little bit about what you need to know about your implant and what I would choose for myself, which may not be what you should choose for yourself. So as we talked about in the previous podcast, we have these different ideas of what's the best quality of vision versus the best range of vision. And that's a good idea to kind of think about, well, what do I use my vision for on a day-to-day basis? What do I want to achieve with my cataract surgery? So of course, everybody wants to get the cataract out, ideally have 20/20 vision, and the ideal situation for most patients is 20/20 vision for distance, intermediate, and reading without glasses. That's for most patients. But the fine-tuning questions is, well, you can't really have it all. There'll be some negatives if you try to have 20/20 vision for distance, intermediate, and reading, meaning your range of vision will be great, but you might get halos and glare, especially if you drive at nighttime, and how much is that going to drive you crazy? So today we're going to kind of go through the different types of data on these particular implants. Specifically, when we look at the light adjustable implant, which gives us the best quality vision that we have to date in terms of precision surgery, trying to get you right on target for being able to see very good distance, or intermediate or reading. It doesn't give you all three. It gives you a little bit of a kind of range, but it's not extended range. But the quality is probably the best because we can really target to correct astigmatism and any type of aberrations in the resulting vision. So that's the light adjustable lens. The best quality range of vision is usually between the Panoptix, which is an Alcon lens, and these are the names of the companies, the pharmaceutical companies, and I'm going to go into that why that's important in a few minutes. But Alcon has Panoptix, which is a wonderful lens. A lot of patients love it. And the Johnson & Johnson, which is a different pharmaceutical company, has the Synergy. And those are kind of these diffractive or trifocal implants, which are, you can kind of debate a little bit what is the material of each one, but the goal of those two implants is try to give you a range of vision from distance, intermediate, and reading. And if you talk to the representative of Johnson & Johnson, or abbreviated J&J, they're going to tell you Synergy is better than Panoptix for this, and this reason. We're going to go through that in a few minutes. And when you talk to Alcon, they're going to say Panoptix is better for this, and this reason. And so when you look at the literature, what I'm realizing as I get older and older is that I've been quite naive about the role. Pharmaceutical companies have a role in this. And I'm learning that surgeons sometimes will choose implants based on a bunch of things. Obviously, data is very important. Objective studies are very important. They look at, what their colleagues are implanting. They look at kind of their own outcomes, but there is a big part where who's being paid to put what implant in. So I was kind of shocked by this, but as I do more and more research, it's there. So you have, of course, wonderful papers that are published in peer-reviewed journals that will say one implant is better than the other, but it's always important to look to see who's paying for the study. And it doesn't make these people bad per se, or the company's bad, because they obviously do a great service to our patients and to the surgeons who provide care to our patients. But you got to know why a surgeon might be recommending one implant over another. So full disclosure, I don't get paid by any of these pharmaceutical companies, and I have a lot of respect for a lot of the studies that have been done, and the implants are wonderful, but you have to just be aware of that. So if a surgeon's kind of pushing one implant versus another implant, I think as a surgeon on my side now, I'm like, well, I would look at their disclosures and financial disclosures and see which grants they're getting, which boards they're on, that kind of stuff. It's a side note, but it's kind of, to me, become an issue. So let's go through a couple of the recent papers that have come out and go through a little bit of what might be the best implant for you. So if you know for sure that you want to wear glasses, just go with one of the monofocal implants. And then that becomes a separate discussion we'll go through in a separate podcast. That's covered by insurance. You will need glasses. You'll be fine. You'll just need glasses. And the surgery will usually go very, very well, very low risk. And you don't have to worry about choosing one of these more innovative options, which are wonderful, but you don't need it because you want to have glasses. And we have many patients that do choose that, which is great. And it makes a wonderful option for patients that don't mind using glasses. For those of you that want to try to have a chance to be glasses free, this is where the controversy comes in, because there's so many great implants now available, and it depends on what you really want to be able to see. So let's say you are nearsighted and you've been nearsighted for years. You may still want to have your near vision, and that's where it gets kind of tricky with those patients, because some of the implants that allow you to have a range of vision, you still may need reading glasses, and you just have to be prepared. I tell patients the worst case scenario of cataract surgery, besides needing another surgery, losing vision completely, losing the eye, your death, my death, those are risks with any surgery. Aside from those, the biggest risk is really, besides needing glasses, is number one. Even if you put the best implant in the world, the best surgeon in the world, you still may need glasses. And it could be just for distance, it could be just for intermediate, it could be just for reading, it could be all three. But that risk is decreasing as the implants get better. The risk of needing a capsule to be open, the posterior capsule opacification, where the capsule gets hazy, which is the back part of the pillowcase, in my analogy of a pillow and a pillowcase, and the pillow being the cataract or dirty pillow, and we're changing out the pillow to an implant. That back part of the pillowcase, or the capsule as it's called, can get hazy in about 30% of patients. And as implants improve, that percentage will continue to decrease, but it's still about 20 to 30%. So those are kind of generally the worst case scenarios of needing the capsule to be open, which is covered by insurance. It takes about less than a minute, almost very, very low risk procedure in general, and needing glasses. So that's where we're talking about. We're talking in a way about a first world issue or a first world problem, because a lot of patients in not the first world just get any implant and they will need glasses, and they're done. So this is kind of a wonderful option and a wonderful decision to have, but it can be overwhelming. So just to go through a little bit about the positives and negatives one more time about the light adjustable lens, the extended range options that we just talked about, Panoptix and Synergy, and then the middle category, which is extended depth of focus. And there's two key competitors in that middle column, which is the Vivity, which is an Alcon lens, and the Symphony, which is now OptiBlue Symphony. So every manufacturer has their kind of keystone implant, and they of course update their materials, so names can change over time. That's why it gets even more confusing when you look at different YouTube videos. So as of 2023, the best options for extended range of vision are Panoptix and Synergy, and the best for kind of the quality vision right now is light adjustable lens, monofocal, and that's a whole different category. So when we talk about the Synergy versus Panoptix, they're both very good about distance, intermediate, and reading. Synergy, according to papers published by Johnson & Johnson, say that the reading is a little bit better with Synergy than Panoptix, meaning you can be at 10 inches, so that's kind of a little closer. If you talk to the Alcon rep, they'll have some, I'm sure, rebuttal there, but generally they're both pretty similar. Synergy tends to have more of a range as opposed to 3 different focal points. The glare and halo tend to be similar between the two on that category because of the way they work. The contrast sensitivity, which some people are very kind of sensitive to, that means the ability to see different types of contrast between like dark and light and so forth, especially if you have glaucoma, maybe a little better with the Synergy than the Panoptics. So that might be a consideration to consider. The difference in quality of vision, again, it depends on who you ask, but there's been some papers that have come out that say Synergy is a little bit better for distance in terms of quality of vision. But I've put in all these implants. It really depends on the patient. It depends on their macula, their cornea, their tear film, their job, how often they're on the screen. So there's positives and negatives with each one of these. One of the new things that I've found out is that the Synergy does have a ultraviolet or a violet filter, but allows the blue light to come into the retina, which they think decreases a little bit the what we call dysphotopsias, or kind of halos and glare, especially at nighttime. But it allows the blue light to come in, whereas Panoptics, there's a blue light filter. And so the long-term outcomes on the retina with blue light coming in, we don't have that data. So just like I was comparing this to baseball stats and kind of, we don't have all the stats to kind of understand what's the best implant for you long-term, and we do the best we can for at least your needs now. But if you do choose a Symphony or you do choose a Synergy, which is this kind of Johnson & Johnson technology where there is a violet filter but not a blue light filter, you may want to wear blue light glasses when you're on the screen until the data comes out to say blue light is not damaging to the retina or macula, which we're concerned about. The Panoptics does have a blue light filter, so technically, we still do recommend UV glasses for most of these, most activities, but a lot of these implants do have UV filter in addition. So it gets kind of confusing with all of these different options. In terms of the light adjustable lens, there is no filter, so we do recommend UV glasses all the time to kind of make sure that your retina is continuously protected. The last thing I want to talk about is the cost. So these extra kind of what we call advanced technology implants do cost extra, and it is an investment of your money and time trying to see if we can get you glasses free, and most patients are glasses free. Some of the data indicates that about 87 to 92% of Synergy patients won't need reading glasses or glasses at all. The Panoptics data is about 80%, depends on, again, the patient and which study you're reading, but they're pretty similar. But most patients with the middle category of the extended depth of focus implant will need reading glasses. And that's the Vivity and the Symphony OptiBlue Symphony, as it's called. So those are the two kind of extended depth of focus implants. The reason why people might choose that middle category is because they don't want to risk the halos and glare, and there is less halos and glare compared to the Synergy and the Panoptics, but you still could get some halos and glare. The contrast sensitivity between the Vivity, that middle category, the Vivity, which is the Alcon lens, and the Johnson & Johnson's OptiBlue Symphony, technically, according to the FDA, the Symphony wins out on contrast sensitivity, and apparently the FDA has said that doctors are supposed to tell patients that get a Vivity that their contrast sensitivity will be decreased. Now, I can tell you, I do a good job of consenting my patients, but it's really, I'm sure most doctors don't tell their patients about Vivity because it's one of those things that it's hard to explain all the side effects and risks with every single implant, but that's something that patients should know that have a Vivity. So that's something that has been proclaimed by the FDA. Otherwise, the monofocal is always a great option, but you will need glasses pretty much for at least one range of vision unless we do the monovision or the mini monovision like we talked about before. Light adjustable lens is my favorite lens right now. It's the one I would have on my eyes currently because of the ability to be so precise and be able to kind of really target astigmatism correction, spherical correction, and change it if I'm not happy. I really like that idea. So that's my favorite lens right now. But again, it depends a little bit on your job, what you do, your lifestyle. Finances are always a concern. But again, the best news is that it's the greatest time to have cataract surgery because we have all these wonderful options. And so if you have any questions, let us know. Of course, check out the other videos we talked about. And please keep us posted if you have any other suggestions for any further topics we talk about. Thanks for joining us. Please pass this on, and please don't forget to subscribe. Thank you.